Hi, I'm Valerie, a registered nurse specializing in wellness. On this channel, I share practical, science based guidance to help you live a longer, healthier life. A few months ago, I shared a very personal video about my own lipoproteinA level, which came back high at 150. This was a bit of a shock to me, knowing that having an elevated lipoprotein can triple the risk of a heart attack, along with increasing the risk of other heart problems. Since then, I have heard from so many of you who are on a similar path, and I promise to keep you updated. This video is that follow up. If you have not seen those videos and would like to start at the beginning, I will link to those videos in this video's description. I have gotten quite a few messages looking for this follow up video. I really do appreciate all the concern and well meaning advice I have received. I waited to make this video for a couple reasons. First, I wanted to complete all my testing and my follow up cardiology appointment. But there was also a scientific study that brought me a lot of comfort when I first learned of it. And I wanted to get all the details before I shared that with you all. And one of the head researchers just sent me a full copy this past week. In this video, I will share exactly what I learned from my follow up appointments and tests, what my doctors think, and how I've continued to lower my overall heart risk, even with an elevated lipoprotein(a). So while a small part of me still wonders if I should still do more testing, I feel far more at peace than I did before. As I shared in my first video on this, after finding out I had elevated lipoprotein(a), I wanted some answers. I did have some minor symptoms I became more concerned about, and I wanted to make sure I was making the right choices moving forward. So I pushed for further testing. Not every provider takes lipoprotein(a) seriously, and because there is currently no proven or approved treatment, many doctors consider it not worth investigating. But I disagree. For me, knowing that number changed how I look at my heart health, and I wanted to be sure that there was not something going on underneath the surface. I also had an added concern because I frequently ventured deep into the wilderness and did not want to suddenly discover I have a heart problem while out there. The first test I had was an echocardiogram. If you haven't heard of it, this is an ultrasound of the heart. It gives a detailed view of how well the heart is functioning and whether there are signs of valve problems like aortic stenosis, which is a known risk for people with elevated lipoprotein(a). I have always had a murmur, so I thought this was worth checking out. The good news is that my echocardiogram was completely normal. My ejection fraction, which measures how much blood the heart pumps out with each beat, was in a healthy range. That means my heart is pumping effectively and there are no signs of structural damage or weakening. There was also no signs of aortic valve disease, which was a huge relief. I think from all of this, that is the thing that I was worried the most about. The second test was a nuclear stress test. A nuclear stress test is designed to measure how well blood flows to your heart during exercise and at rest. It uses a small amount of radioactive tracer and imaging to reveal whether any part of your heart is not getting enough blood, which can indicate blocked arteries. I did the treadmill version using the Bruce protocol. That is a specific method of gradually increasing the treadmill speed and incline in time stages. It is designed to push your heart to its max, and I'm proud to say that I did hit that maximum level, which really was expected because of all the hiking and climbing that I do. My results came back perfectly normal. No areas of concern, no signs of impaired blood flow, and nothing to suggest active plaque buildup in my coronary arteries. When I went back for my follow-up appointment, I met with the nurse practitioner who went over everything with me. She and the cardiologist both agreed that despite my elevated lipoprotein(a), my overall risk is pretty low. And the biggest reasons for that is my healthy lifestyle. They were both very impressed by my diet and activity level and encouraged me to keep that up. This did give me a tremendous amount of reassurance. So it doesn't mean that I'm in the clear forever, but it does mean that what I'm doing is working. And for now, there is no sign of disease in my heart or arteries. We talked about one of my main symptoms of concern, which was an increased shortness of breath while hiking uphill. And I've talked to a couple other healthcare providers about this, and we've all kind of settled on the same thing. And that is that we now all suspect that increased shortness of breath with activity may have been the lingering effects of a mild, long COVID case. And the timing lines up. And that explanation makes a lot more sense in light of these test results. Of course, a small part of me still wonders, should I ask for even more testing? It's hard to fully quiet that inner voice once you've had a scare like this. But between the clean test results and what I'm about to share from that scientific study that I mentioned, I do feel a lot less nervous now. At my follow-up appointment, the nurse practitioner explained why they weren't overly concerned with my heart disease risk, even with my elevated lipoprotein(a). They were not minimizing it. They do agree that it is a significant risk factor, but they were also looking at the whole picture. And in my case, that picture is a pretty healthy one. Since there are currently no proven approved ways to directly lower lipoprotein(a), the best approach is to reduce cardiovascular risk through every other possible route. And that is pretty much what I've been doing over the past several years, even if that was kind of by accident. I originally changed my diet and lifestyle to help manage my osteoarthritis. One of my knees and an ankle was getting pretty bad, and doctors really had no more options for me. My hiking and climbing that I love so much was in jeopardy, so I began looking for ways to improve my joint health. I have a lot of videos on my channel about osteoarthritis, but for now, I'll just say that I discovered that osteoarthritis is very much misunderstood. I did a lot of research and ended up identifying a dietary pattern that is pretty much a modified version of the Mediterranean diet. This, along with other lifestyle changes, greatly improved my joints and made me feel better than I did in my 20s. But since then, I have discovered that I wasn't just helping my joints. It just so happens to be one of the most evidence-backed eating patterns for also lowering heart disease risk. I'll be going into more detail on those lifestyle choices later in this video, but for now, what matters is that I have been living in a way that supports heart health, and that made all the difference in how my doctors viewed my current risk. In fact, someone who doesn't have an elevated lipoprotein(a), but who eats a standard American diet full of fatty processed foods, who gets very little physical activity, has like high blood pressure, poor cholesterol numbers, or elevated blood sugar, is likely to be at a higher risk for cardiovascular disease than I am. Because heart disease risk isn't about just one number. It is the cumulative effect of health choices over time. After I got my reassuring test results, I still had a bit of lingering doubt, and I think that is normal. When you learn that you have a higher genetic risk, it is hard to completely turn off that worry. That is why when I came across a study that looked specifically at lipoprotein(a) and cardiovascular risk, I was immediately interested. And once I read the full results, it truly gave me peace of mind. I remember just smiling when I saw the title. This study followed over 2,000 participants for 10 years and confirmed what we already know, that elevated lipoprotein(a) increases the risk of cardiovascular events. But when they factored in dietary patterns, specifically how closely someone followed a Mediterranean-style diet, the increased risk from lipoprotein(a) essentially disappeared. In statistical terms, the Mediterranean diet mediated the association between elevated lipoprotein(a) and heart disease. That means for people who had high lipoprotein(a) but consistently ate a healthy Mediterranean-style diet, the risk of heart disease was significantly lower, almost to the point where their lipoprotein(a) level no longer predicted future problems. And it wasn't just the diet either. The researchers also used a metric called the Successful Aging Index, which includes things like physical activity, social engagement, and overall lifestyle habits. When both healthy diet and lifestyle were taken into account together, the protection was even stronger. Reading that after years of already living a lifestyle that aligned with those principles was a huge relief for me. It felt like all the small, and I'll admit, sometimes difficult choices that I have made have been worth it. And even though I cannot change my lipoprotein A level, I can change how it affects my future. It was also a relief to know that it's not about being perfect. The study did not require people to be vegan or give up every indulgence forever. It just showed that a consistent pattern of heart supportive eating and living can completely shift the equation, even for those of us with genetic risk. This study will now become one of my go-to pieces of evidence when people ask me what to do after learning that they have a high lipoprotein A. Because the takeaway is pretty clear. Your genes are not your destiny, especially when it comes to your heart. By now, you have probably figured out that diet plays a huge role in how I support my heart health. And today, I want to introduce you to the eating pattern that I personally follow, something I now refer to as the Flexi Mediterranean Diet. This is a flexible, real-world approach grounded in solid scientific evidence. The foundation comes from the Mediterranean diet, which has been studied extensively and consistently is linked to lower rates of heart disease, stroke, cognitive decline, and even early death. But I have taken it one step further, making it more plant-forward while still leaving space for occasional fish and meat. That is where the flexi part comes in. So that comes from the flexitarian diet. The Flexi Mediterranean diet is built around vegetables, not as a side dish, but as the centerpiece of every meal. Most meals include at least 2 servings of vegetables with whole grains, legumes, maybe some seeds or nuts, and healthy fats like olive oil supporting that base. Animal products are used sparingly, and when they are high quality and lower in inflammation, like cold water fish or pasture-raised poultry. This way of eating is rich in fiber, antioxidants, and anti-inflammatory compounds. It supports heart health, brain health, longevity, and daily well-being. It also helps to manage blood sugar and reduces the chronic inflammation that is linked to so many diseases, including osteoarthritis and cardiovascular conditions. Now, this is all based on solid, peer-reviewed science. And I just want to take a minute to address something that always seems to come up whenever I say the word plant in a video, because I really do get some nasty comments. Some people seem to get so triggered when they think you're trying to take their meat or their fat away. There's actually some evidence emerging that high-fat diets can induce addictive-like behaviors. So I'm wondering if there is a connection there. Anyway, if you're going to comment that another dietary pattern is better, please do not without including a link to a scientific study. So I'm not talking about blog posts or videos or someone's influencer newsletter. And I'm definitely not talking about one person talking about their perfect calcium score, even though they eat 16 cheeseburgers a day. But I mean a real peer-reviewed scientific source, because that is the standard I hold myself to. That is where I get my information from, and it is the standard that I expect in return, especially if you're going to start arguing with me. I have done my research. I have checked my data, and I have read the studies, many of them. And yes, some other eating patterns do show a benefit when switching from the standard Western ultra-processed diet. But the Mediterranean diet, and especially this more plant-forward version of it, remains the most scientifically validated way of eating for reducing heart disease risk, lowering inflammation, and improving overall health and longevity. So yes, you are welcome to disagree, but please come with evidence, because this channel is about science-based facts and about helping people make choices that genuinely improve their health. Now, on to other lifestyle factors that impact heart disease risk. Because while diet is a major piece of the puzzle, it is far from the only one. The most powerful thing that we can do to lower heart disease risk, especially when we can't control a factor like the lipoprotein is to build an entire lifestyle that supports our cardiovascular system in every possible way. Physical activity is a huge part of that, and it's something that I have made a consistent part of my life. I always have been active, but I used to be more of like a weekend warrior. But now I make sure that I walk every single day. I originally started this to keep my joints happy, but now it has become something that is a normal part of my routine. If I miss my walk, I just feel off. It's not just a physical habit anymore. It has also become a part of how I manage stress, and I'll share a little bit more about that coming up. Sleep is another area that I have come to take more seriously. Many people are all too ready to sacrifice sleep, but research shows that sleep deprivation drives up inflammation and increases cardiovascular risk. These days, I aim for at least 7 to 8 hours most nights, and I treat that as non negotiable. There are real ways to improve sleep duration and quality, so search for those videos on my channel. I also have a whole course on smarter sleep. If you're interested in that, please comment below and I'll drop you a link. And then there is stress. Stress management is another thing that usually gets put back on the back burner, but it really does affect everything, including blood pressure, hormone balance, inflammation, and even how your blood clots. Stress management is not about avoiding all stressors, but rather it is about how we respond to them. That is why I have built tools into my life to manage it proactively. One of the most effective for me has been integrating a mindfulness practice into my daily walks. I use part of that time not just for movement, but to quiet my mind, notice my surroundings, and be fully present. It is such a simple habit, but it is incredibly grounding. I'm going to be doing a video on that in the very near future. Also, other ways to integrate mindfulness into everyday life. And this will be especially applicable for people who are easily distracted like me. So, subscribe to my channel and hit the notification bell if you're interested in seeing that so you know when it comes out. Other habits like breath work, quiet moments in nature, and rest time can become other types of small rituals that help reset the nervous system and keep things in balance. Again, stress management is not about eliminating stress altogether. It is about responding to it in healthier ways. None of this happened overnight. I didn't just flip a switch one day and become perfectly healthy, and I don't really call myself perfectly healthy now. But I have built up these healthy habits over time. And I always encourage people to start small. Choose one or two changes that you can realistically stick with, then add on from there. Trying to overhaul everything at once, which is kind of the popular theme on social media. And that is because it feels very exciting at first. You're going to make all these big changes. But this approach often leads to burnout, or you end up feeling like you failed. Sustainable change happens in layers, and it is the small, consistent actions that add up that truly make the biggest difference. So, where does all of this leave me now? Honestly, I feel more empowered than ever. I admit that when I first found out about my elevated lipoprotein I was scared. But since then, I have learned that having elevated lipoprotein does not mean that you are destined for heart disease. It might mean that you need to pay a little bit more attention, take action, and focus on the things that you can control. For me, that has meant advocating for my own testing, after learning about the result, following through on my follow ups, and building a lifestyle that is rooted in science and consistency. This includes all the little daily choices that affect my heart risk. I choose to show up for my body every day. And that does feel empowering. That includes all the little daily choices that affect my heart risk. I choose to show up for my heart and for my body every day. And that does feel empowering. So if you were here because you found out that you have an elevated lipoprotein A, I want you to know that you are not powerless. You are not alone, and you absolutely have options. You can take steps starting today that will lower your overall risk and protect your long-term health. Even if you can't change your genetics, you can change your trajectory. And yes, there is still a little voice in the back of my mind that wonders if more testing might be helpful. That is just part of being human. But now I carry that curiosity with a lot less fear and a lot more peace. If you would like to learn more about the Flexi Mediterranean Diet and how to start applying it into your life, I have created a simple guide that you can download. It includes meal planning tools to help make this sustainable long term. You can find a link in the description for this video. I hope this video helped you feel more informed or reassured. If it did, I would be grateful if you gave this video a like. And please leave a comment or let me know if you have any questions. And subscribe to my channel for more heart-healthy, evidence-based content. Thank you so much for watching. Take care of your heart. And as always, please take good care of yourself.